There are 4 types of malaria. We have the Plasmodium vivax, we have the Plasmodium malaria, we have the Plasmodium ovale, and then you have the Plasmodium falciparum. A very quick one today, talking about a disease people underrate, that is malaria today. Now I'm talking not malaria generally, I'm talking of an aspect of it, which is cerebral malaria. Most of us may have experienced someone that passed through that stress of cerebral malaria, where you see a person in the morning or you see a person in the afternoon, and evening, the person is normal. The next moment you hear the news that the person is almost behaving like a mental case, having some mental problem. Now what happens is that there are 4 types of malaria. We have the Plasmodium vivax, we have the Plasmodium malaria, we have the Plasmodium ovale, and then you have the Plasmodium falciparum. This type is the one that causes this type of malaria, Plasmodium falciparum. So what it does is that it doesn't mean that malaria enters the brain, or the malaria parasite doesn't enter the brain most of the time. But what it causes is just clumping, that is thickness, making the blood cells sticky. They now stick together and go to the small arteries of the brain and block blood supply to those arteries, and in some cases it affects the brain, causes edema and all those things in part of the brain. So the brain now the person starts misbehaving, or the person may go into coma, or the person may go into neurological deficit. A lot of things can happen, especially concerning the brain. So the person goes down. In some cases, if the attention is not given to the person on time, the person may go from it. It's something that we see almost frequently in the hospitals, and it's something that people underrate. Now, the consequences of this type of malaria is that most of the time it leads to loss of life. It leads to neurological. When the person passes through this, after some time, the mental capacity of the person may be impaired. The long-term effect, and there may be memory loss and all the kind of, a lot of things happening on the brain. So it's something that is very important that we talk about. Now, how do you prevent it? Prevention is just mosquito, because what gives malaria is mosquito. Most people don't know that it's mosquito that gives malaria. The female Anopheles mosquito, it is what gives this malaria type, this type of malaria, and it's common in the tropics, and it affects preschool children more than adults. Most of that, it affects children, causes convulsion in children, causes them to have neurological deficit, and it affects their brain development. And in most cases, it leads to loss of lives among the children. It is one of the malaria that children suffer from. You see a lot of convulsion and the other complications, so many other complications that come from it. So prevention is prevent mosquitoes. And then when you notice the sign of it, take the person to the hospital. The earlier, the better, because some things can be done to save the child, to save the brain, and to save the person. Most times, if you meet the wrong person, the wrong medical personnel, or any person that doesn't have the knowledge, the full knowledge of this, they may start treating a person that is having that malaria as a mental ill patient, without knowing that it's malaria that is causing it. I've seen cases where I entered the hospital, I saw the patient, and they have already started treating the person as a mental. I said, what kind of rubbish is that? It's not the fault of the hospital, because most of the time the presentation is almost the same way a mental ill patient presents. So, but what I say, let the prevention be very active. Let parents make sure that they don't allow mosquitoes to come in contact with their children. And even if they have it, make sure you take the children to the hospital on time. These things are treatable. It's not something terrible, but it can be harmful when it's not done on time. So let's bear this in mind. Whenever we have somebody in these tropics behaving in an abnormal way, let's remember malaria. It's very important, because we overlook it. and it does harm. So let's follow this page for more insights. As I always say, the more knowledge of your health you have, the healthier you live. Keep a date with us on this page for more informative videos. Thank you.